Imagine walking into an operating room, knowing you will feel everything. No anesthesia. No peaceful countdown from 10. No waking up after it's over. You're awake when the surgeon picks up the knife. And if you lived just 180 years ago, this wasn't a nightmare. This was surgery. Today, millions of people go unconscious before an operation and remember almost nothing. But for most of human history, surgery presented you with a terrifying choice. Endure unimaginable pain. Or let the disease or injury kill you. And strangely, pain wasn't even the only thing you had to survive. Imagine London in the 1840s. Your leg has been badly injured. The wound becomes infected. The surgeon tells you there is only one realistic option. Amputation. There is no modern operating room waiting for you. Instead, you're taken into an operating theater. And theater is exactly what it sounds like. Medical students crowd into raised galleries around a wooden operating table. They're not there to comfort you. They're there to watch. The surgeon may give you alcohol or opium. You might be given something to bite. Assistants stand around the table ready to hold you down. Because once the cutting begins, your body's instinct is simple. Escape. Even if you agreed to the operation. We know something about how terrifying this was because patients actually described it. In 1811, novelist Fanny Burney underwent surgery to remove a breast tumor. She remained conscious. Later, she wrote about the overwhelming agony and the scream that continued during the incision. The operation lasted around 20 minutes. Imagine 20 minutes today. That's barely enough time to watch part of a YouTube video. Now imagine experiencing surgery during every second of it. And this created a strange requirement for surgeons. They had to be fast. Not because hospitals were busy. Because every additional second meant additional suffering. And one surgeon became legendary for speed. His name was Robert Liston. Liston was one of Britain's most famous surgeons. During an amputation, students reportedly watched the clock. His reputation wasn't built around being gentle. It was built around getting the operation finished before the patient's body completely collapsed under the experience. Before anesthesia, speed could genuinely save lives. A surgeon couldn't carefully spend hours operating. He needed to cut, remove the limb, control the bleeding and finish. Fast. But there's something even more disturbing. If you survived the operation, you still weren't safe. In the 1840s, germ theory had not yet transformed medicine. Surgeons didn't understand infection the way we do today. Surgical instruments could be reused without modern sterilization. Doctors could move between patients without properly disinfecting their hands. Even blood-stained surgical clothing could be treated as evidence of experience rather than contamination. So imagine surviving the operation. You've made it through the knife. Days later, you develop a fever. Your wound becomes infected. And the people treating you may not understand what's actually killing you. This was why surgery could remain deadly even when the surgeon performed the procedure successfully. Then came doctors like Ignaz Semmelweis. Semmelweis showed that something incredibly simple could dramatically reduce deaths. Washing hands. Today that sounds obvious. At the time, it challenged how doctors understood disease. His ideas faced enormous resistance. Medicine had begun learning how to cut into the human body. It still had to learn how not to carry death into the wound. But another revolution arrived first. And it happened in Boston. October 16, 1846. Massachusetts General Hospital. A patient named Edward Gilbert Abbott was brought into an operating theater for surgery on his neck. A dentist named William Morton arrived with ether. Abbott inhaled the vapor. And became unconscious. Then surgeon John Collins Warren began operating. Think about what happened next. For generations, operating theaters had been associated with struggling patients and screams. But now, silence. The surgeon cut. The patient didn't fight. He didn't need several people pinning him down. When Abbott regained consciousness, he reported little meaningful pain from the procedure. Warren turned toward the astonished audience. The age of surgical anesthesia had effectively arrived. And news traveled quickly. Soon, surgeons across the Atlantic were experimenting with anesthesia. Robert Liston, the man whose career had been built around operating faster than almost anyone else, used ether during an amputation later that year. The patient was unconscious. The leg was removed. And according to the famous account, when the patient woke up, he couldn't believe the operation had already happened. In a matter of months, one of surgery's oldest assumptions had been shattered. The patient didn't have to suffer. But surprisingly, not everyone immediately loved the idea. Some doctors worried anesthesia itself was dangerous. Others believed pain might somehow help patients survive. And some even treated enduring surgery while conscious as a demonstration of courage. The transcript also describes how Queen Victoria's use of chloroform during childbirth in 1853 helped make resistance to pain relief increasingly difficult to defend. Then medicine attacked surgery's other great enemy: infection. By the 1860s, Joseph Lister began using antiseptic techniques associated with carbolic acid. Slowly, surgery transformed. Anesthesia helped remove the agony. Antisepsis helped reduce infection. And eventually surgeons were able to perform procedures their predecessors could barely imagine. Now think about what happens today. You enter a hospital. Machines monitor your heart. The surgical team uses sterile equipment. An anesthesiologist gives you medication. Someone tells you to count backward. 10. 9. 8. And then suddenly you're awake. The operation is already over. You might complain about being sore. You might hate the hospital food. You might ask what time it is. But there's something you're probably not thinking about. How extraordinary it is that you don't remember the knife. Less than 2 centuries ago, patients entered operating rooms knowing they might experience every second. Today, unconsciousness during major surgery feels so normal that we barely think about it. And maybe that's the strangest part of medical progress. Some of humanity's greatest miracles eventually become ordinary enough to annoy us. The next time you hear someone say, "Count backward from 10. Remember what those words replaced. And ask yourself, could you have climbed onto that operating table in 1842?